Hello and welcome to ABC Nursing UK. This space is created to turn heavy theory into a visualized learning using animated mind maps, easy mnemonics, and bite-sized explainers to help you ace your studies, placements, and exams. Ready for a simplified learning? Let's get into it. Ever heard of someone being sectioned under the Mental Health Act? Well, in this video, we will be breaking down the commonly used civil sections of the UK Mental Health Act, the ones all nursing students need to know. The Mental Health Act 1983, which has since been amended to the Mental Health Act 2007, is the UK law that allows certain people with mental health conditions to be detained, assessed and treated in hospital, even if they don't want to be there. It gives legal powers for the protection of individuals and others from harm and to ensure necessary treatment is given. The Act is divided into sections, legal powers, which sets out when and how someone can be detained. It is all about balancing the rights, safety and care for people experiencing serious mental health difficulties. Being sectioned means a person is detained under the Mental Health Act. This means that it is not always voluntary, they are not allowed to leave the hospital, and it's done to keep them or others safe. Let's consider who has the power to sign these sections. Firstly, if the patient is voluntarily in the hospital, a nurse can section the patient using Section 5(4) for up to 6 hours, whereas upon assessment, a doctor under Section 5(2) can further detain a patient in the hospital for up to 72 hours. More importantly, Section 13 sets out the importance of an approved mental health practitioner, referred to as AMHP, whose role is to coordinate the process and consult medical recommendations necessary for signing off for Section 2 assessments, Section 3 treatment, as well as in Section 4 for emergency admission. Approved AMHPs could be a nurse, a therapist, a social worker, or a psychologist. What are the common civil sections of the Mental Health Act? Firstly, we have Section 2, which requires that the patient should have a mental disorder. The patient needs to be detained for a short time for assessment and possibly medical treatment, and it is necessary for the patient's health or safety or for the protection of other people. Section 2 allows for the patient to be kept in hospital for up to 28 days. This section is signed by 2 doctors and 1 AMHP. Medications administered in these circumstances may include antipsychotics, anxiolytics, or mood stabilizers, depending on the patient's presentation. While with Section 3 treatment, the patient also needs to have a mental disorder detained for their own health, safety, or for the protection of other people. But the treatment can't be given unless the patient is detained in the hospital. Section 3 can last up to 6 months and can be renewed by another 6 months, as well as a further 12 months. This section also requires signatures from 2 doctors and 1 AMHP. Medications administered in these circumstances may include antipsychotics, antidepressants, mood stabilizers, anxiolytics, sedatives, as per diagnosis. This can be administered without consent in the first 3 months. After 3 months, a SOAID, second opinion appointed doctor, is required for continued treatment without consent. Section 4 is an emergency order, where the patient must have a mental disorder, is unwell enough to be in hospital. Professionals need to believe that the patient should be in hospital for their own health or safety, or to protect other people. Also, it is urgent and necessary for the patient to be in hospital, and more importantly, finding another doctor would cause an undesirable delay. Section 4 allows for the patient to be sectioned for up to 72 hours, which signatory from 1 doctor and 1 AMHP. The medications to be administered may include rapid tranquilization for safety, short-term use of antipsychotics or sedatives, Treatment without consent, allowed only to prevent serious harm during this period. Another way a patient can be sectioned is through the application of the Section 135 warrant enforced by the police. Section 135 grants the police the authority to enter your residence and escort you to or retain you at a secure location for a mental health evaluation. This could mean keeping you within your own home. To do this, the police must obtain a warrant from a magistrate's court. Equally, Section 136 of the Mental Health Act allows the police to remove a person from a public place if they appear to be suffering from a mental disorder and are in immediate need of care. This section enables the police to take the individual to a place of safety where they can be assessed by a mental health professional. The aim is to ensure the safety of the individual and others, providing necessary support and intervention. Medications to be administered for the Sections 135 and 136 include emergency sedation if needed, e.g. haloperidol, lorazepam, or rapid tranquilization if the person is acutely disturbed, and short-acting antipsychotics or benzodiazepines may be considered. PRN medications may be used to manage agitation. For the supplementary sections, these are the sections necessary for during and after care of the patient. One of which is the Section 17 leave, which allows detained patients to be granted a leave of absence from the hospital. This leave is an agreed absence for a defined purpose and duration, which is considered an important part of the patient's treatment plan. It is granted by a responsible clinician who has overall responsibility for the case. A responsible clinician or a nearest relative can discharge a patient if they don't think that the patient meets the conditions of being under the Mental Health Act anymore. Under Section 23, they can ask the hospital manager to review the detention. Also, if the patient is detained under Section 2, Section 3, or Section 37, an application can be made to a tribunal to appeal against the section. Here, a community treatment order, CTO, could be granted to allow the patient to remain under the Mental Health Act but be treated safely in the community rather than a hospital. Before a patient is discharged from the hospital, a care plan should be put in place to cover the care and the patient's needs in the community. Under Section 117, health authorities and local social services have a legal duty to provide free aftercare for people who have been discharged. The duty to provide aftercare also applies if you're given Section 17 leave or are under a community treatment order. Now let's recap. We know that the Mental Health Act 1983 has since been amended by the Mental Health Act 2007. This act gives legal powers for the protection of individuals and others from harm and to ensure necessary treatment is given. The frequently used civil sections include Section 2, which governs the assessment of a patient for the duration of 28 days. Section 3 is for treatment, which allows for a 6-month duration. Section 4 is the emergency section, and the duration is for 72 hours. Section 5.2 gives doctors the holding power for 72 hours. Section 5.4 gives nurses the holding power for 6 hours. Section 135 warrant gives the police power to make into a private property to issue an arrest warrant. Section 136 grants the police power to arrest in a public space. The supplementary sections include the Section 17, which allows for leave of absence from the hospital, Section 23, which is necessary for discharging the patient, and Section 117 is the recommended free aftercare done by the local services and health authorities. Thanks for watching ABC Nursing UK. If you enjoyed this video, please don't forget to like, share and subscribe, as we hope to upload more study videos for nursing students just like you.